Do you feel a lot of pain or tension right between your shoulder blades in this area here? Then tight rhomboid muscles may be your problem. So if you struggle with discomfort in this area, I'm going to show you how to take the rhomboid muscles through my proven functional mobility formula, where I teach you how to reduce tension in that area, but also how to restore motion and reinforce it with some strength exercises for long-term relief. So let's dive in. So the first R stands for recognize. So first we want to recognize where our symptoms are. So if you're experiencing a rhomboid issue, it's going to be in this parascapular region, right between your spine and your shoulder blades, right in this area. So if you have a lot of muscle knots or you're always tight in that area, then it may be your rhomboids. But the second part is we want to recognize a couple baseline tests that we can test at the end of this routine to make sure we're making progress. So some simple baselines for your rhomboids would just be checking some range of motion. So first you can test your neck range of motion. Do you feel any pinching in that area with rotation? Do you feel anything when rotating your thoracic spine or that mid-back? Or do you feel any discomfort with shoulder ranges of motion? You want to test some of these movements out and collect some baselines before we move on to our first move. So the second R stands for reduce tension. Specifically, we're going to reduce rhomboid muscle tension. And for this move, we just need one piece of equipment. That equipment is a exercise or a yoga ball. Now, if you don't have a yoga ball, I'll show you how to do this without, but if you have one, it's really gonna help take this stretch to the next level. So first thing we're gonna do, we're gonna give this ball a big old hug, and then we're just gonna bring it down to the floor here. So what we're gonna be doing is some posterior expansion breathing. So as I'm hugging this ball, it's compressing the front side of my rib cage or my thorax. So then as I do some guided breathing, we're gonna get some more expansion in the backside. And the reason I like this is it doesn't discriminate. It loosens up your thoracic spine, rib cage, and of course your rhomboid muscles. So when you're hugging this ball, you're gonna roll forward until your shoulder blades are pointing straight towards the ceiling. And then from here, you're just gonna do some nice nasal breathing. So I'm gonna breathe in through the nose, out through the mouth. And with each breath, I'm thinking about filling a balloon right between my shoulder blades. We're gonna do a solid 10 to 15 breaths here. So in through the nose, out through the mouth. So from the backside, I reach and give this ball the biggest hug I possibly can, and then I round forward, and then from here, we're just gonna breathe. And just after doing 5 or 6 breaths in that area, I even got some free pops because we got some nice distraction in the joint segments in that area. Now, if you don't have a yoga ball, no problem. To get a similar stretch with no equipment, we're gonna start in this quadruped position, and then we're gonna come down into this low quadruped. And then from here, I'm thinking about driving my sternum towards the ceiling, getting a nice little turtle back here. And then now I'm just gonna simply think about breathing or filling a balloon in between my shoulder blades. So again, in through the nose, out through the mouth. And as I breathe out, I'm trying to round further into that flexion range. Same thing in this position, 10 to 15 breaths, and then we're ready to move on to the next move. The third and next R is restore joint range of motion. So for this next move, we're gonna open up that mid-back or continue to open up that thorax with one of my all-time favorite stretches, which we just call the open book stretch. So from the sideline position, you're gonna bring your top knee out in front at a 90-degree angle. You're gonna pin that sucker with this bottom arm, and then you're gonna go hand on the chest here, and then you're gonna slowly rotate until you hit a lot of tension. And with this hand, I'm thinking about peeling my chest open. So we really start to open up the spine in between the shoulder blades. And then once I find where my tension is, now we wanna do some breath work with it. So I'm gonna breathe in, breathe out. As I rotate, again, trying to peel that chest or really open up the joints on the backside there. And for this one, you're gonna do a solid 8 to 12 reps. And with each repetition, you're trying to see if you can go further and further into that range. So let me show you from a different angle. So from the top down view, top leg over, bottom arm pinning, hand on chest here, and we're gonna breathe in, breathe out, and really think about ripping open your chest and working into that nice thoracic rotation. So I feel a nice stretch in my mid-back, rib cage, and between the shoulder blades where those rhomboids live. Again, you want to go further and further with each rep, and you're going to do a solid 8 to 12 here. After we reduce the muscle tension, restored that joint range of motion, we're ready for the next move. The fourth and final R stands for reinforce. So now we're going to add a strength and stability exercise to the muscles in this area so we can really hold on to the changes we just made. So first thing you're going to do is make a diamond with your fingers here, and you're going to have that right around forehead level as we come down into that low quadruped position again. Once I'm here, I'm going to shrug up, then shrug down, really pack the shoulders, and then I'm just going to come up into what we call a low bear position. So I'm keeping my chin retracted, or a nice chin tuck, to feel those deep neck flexors working a little bit more. And then while I'm here, I'm just going to simply try to do some diaphragmatic breathing while I try to stabilize my body weight through my shoulder girdle. So this seems simple, but you'll be surprised when you get into this position how quickly you start shaking. And most of you might struggle just trying to maintain a normal breathing pattern here. So if you can, you want to hold this for a good 30 seconds or so. Or if that's too challenging, you can do what I just call low bear rises. If I'm starting this low quadruped, I'm going to push my butt up towards the ceiling, really loading through the shoulder girdle, come back down, touch, and then just simply repeat here. So if this is a little bit easier for you, you're going to do a solid 10, maybe even 15 reps here. And it doesn't take long. I feel everything working to stabilize that area. And we're getting some nice strength, stability, and just overall blood flow to the tissues. Now, after you've completed this full routine, there is one bonus R, and that is to reassess. So how do you know if this is a helpful routine for your rhomboids? Well, if you remember at the beginning, we recognized where our symptoms were. So let's say you had pain or discomfort in the left parascapular region. After doing this routine, did the volume knob decrease on your symptoms? If so, then you really know this is a good routine for you. But secondarily, after this routine, did your function improve? So if you also remember, we wanted to recognize a couple baseline tests. So afterwards, recheck those tests. Does your neck range feel smoother without a pinch in that area? Do you have more range of motion in your thoracic spine before feeling any symptoms there? Or can you use more of your shoulder range of motion without it poking the bear back here? If so, then you really know this is a good routine for you, because as we improve the function in that area, even if the symptoms don't change, eventually we know they're going to improve over time, especially as we're consistent with the routine. And why is that? Well, think about it. If the function improves, you're able to move and do more of your daily activities without poking your pain alarm. And if you're not setting off that pain alarm more and more, then eventually you're going to start to feel better. So that's why it's super important to recognize not only your symptoms, but also those baselines, so then you really know if this is going to help you or not. And if this formula makes sense to you, this is how I rehab every single patient in the clinic. So if you have a muscle, joint, nerve, or any other tissues that you have an issue with, well, let me know in the comments below and I will run them through this functional mobility formula next. And don't forget to keep it moving.